Welcome, Dr. Shetty,
Yes, ma'am.
to Editor's Speak. How are medical negligence cases decided differently by courts as compared to other cases in consumer courts?
I buy a refrigerator or an AC. It goes bad. I go to consumer court. The consumer court makes a judgment and awards compensation. But cases of medicine, in the field of medicine, cannot be based on the same parameters. A patient comes to me, tells his complaint. I make a provisional diagnosis. There are times when I make more than one diagnosis. It's called differential diagnosis. I investigate, I arrive at a final diagnosis. There are times, despite all investigation, reports are normal. Doctor is clueless. At that time, I follow what is called the philosophy of masterly inactivity. I give placebos, wait, and once I conclude or come at a diagnosis, I treat the patient. This cannot be explained to a normal person. He may think you don't know anything. So, the same parameters which are used in other cases cannot be used in medical negligence cases.
So then how do courts decide between an error of judgment and a wrongly diagnosed and treated patient in cases of negligence?
The court usually observes whether another doctor of equal qualification and reasonable skills would have acted differently in this case. That is the basis on which they arrive at a conclusion and make a judgment in cases of medical negligence.
So can you illustrate this with a case or a judgment?
Recently there was a judgment from the National Commission. A young boy, 36 years of age, pain, swelling in the left knee joint. Brought to the hospital transferred the patient to a tertiary care center for better management. Here there was a differential diagnosis made of osteomyelitis of the fibular bone or a neoplasm of the head of the fibular bone. The doctor wanted a nucleoside bone scan to make a final diagnosis. The patient was sent to another center. The aforementioned investigation was performed. The patient was brought back. On coming back, the patient was breathless. The physician transferred the patient to the ICU. He made a diagnosis of pulmonary embolism secondary to DVT from the knee joint. The investigation performed revealed the 2D echo to be normal, the WBC kind to be high. A septicemia was diagnosed, antibiotics started, patient became serious, patient put on ventilator, died of multi-organ failure. The relatives of the patient said that the doctors had missed DVT and their septicemia was an afterthought to hide the negligence. The court perused medical records, accepted that any other doctor would have treated the patient the same way, and hence the court did not hold the doctor or the hospital negligent.
So what would be your key take-home message from this judgment?
My advice to doctors will be follow the medical texts. Courts are not bloodhounds. They don't dig up dead bodies. They are going to be watchdogs. They are going to watch whether the doctors followed the protocols. The court will want the doctor to follow the medical texts religiously. Courts do not bother about the end result of a treatment. Even if the end result is not according to anticipated lines, the court does not have a problem. The court will not hold the doctor negligent.
Thank you, Dr. Shetty, for your valuable inputs.
Thank you.